And you've had this pretty significant number of different pain syndromes. I mean, I think the condition that was officially described was neuropathic pain. And our journey was pretty, I would say, for my practice, is pretty usual journey for some of my patients, or for a lot of my patients, but your response was quite good.
So I would say that for about at least 10 years, I have had a liver pain, and bladder pain. And I increasingly started having problems on my left-hand side. And I had traditional physicians. I had one physician who was probably well-intentioned, who I saw for maybe about 10 years, who was very upset because every time I took statins, my liver hurt a lot, so I stopped taking them. She tried, I had high blood pressure, and she said that I had to take high blood pressure pills because the reason was that my father had high blood pressure. My left side started
Your
getting
left
weaker,
side.
much weaker, and I started having pins, you know, like
Pins
little,
and needles.
like ants going around. And I got tired because this physician didn't solve my problems. I went to see another physician there, and then I went to see you, and you suggested that I have a mercury test.
I assessed your lifestyle, and you're exactly right. Your lifestyle is very healthy, and it's very unusual to start developing all these problems. So those are all symptoms that we see quite frequently with the mercury toxicity, and as I pointed out to you a while ago, you've also had a mouthful of silver fillings, which are 50% by weight mercury. So that's how I think we very quickly said that we should get the mercury test, and it came back very elevated. And subsequently, we've detoxified your mercury levels, and we also replaced all your silver fillings. And how are you feeling today?
I feel much better. I think I didn't realize how bad I felt.
How are you feeling today?
I feel much better. I think I didn't realize how bad I felt. I mean, I've always been a very high energy person, so I was functioning fine. But it's much less effort to have all that energy now. I feel much better. I thought that I had bad vision because I'm very short-sighted. But after I started treating the mercury, I realized that I had very severe tunnel vision. And now I started discovering vision on the sides of the space. I saw colors are shinier. The lights are brighter.
We do know this for a fact, that there's a lot of mercury toxicity, especially in the United States. There are several parts of Europe that outlawed silver fillings. Norway is a good example, because the data is quite consistent, and unfortunately American Dental Association continues to deny this problem.
Well, the first thing I would say is that anybody who has mercury in their mouth should go directly to their dentist and they can do it year by year, if I had known. So the first thing I would say is nobody should accept that they or anybody in their family has mercury in their mouth. The second thing is that actually I feel a lot better, and even though I thought I was okay, I think people should realize that they can feel better once the mercury is out.
The removal of fillings is not, unfortunately, is a lot more complicated issue. I think if somebody is very healthy and they have only 1 or 2 fillings, I think it's very reasonable to have them removed with a dentist who does not practice safe methods of removal. You've had quite a number of them. I think by the time you came to see me, I think removing them all with a regular dentist potentially could have presented an additional challenge, because during the drilling with the regular drill, a lot of vapor gets released, and some patients actually can get more toxic after the removal than before. So we, Institute Dr. Singer has been doing a lot of removals in a very safe manner, where the removal gets done in such a way that the exposure to mercury vapor is minimized.
People shouldn't have mercury, and I think they shouldn't accept that from their dentist.
Patients beginning to recognize this being a problem, and I think there's a pressure on dental associations to really use the amalgams less and less, and we are seeing a movement, slow movement, but to decrease using of annual amount of mercury in the United States. Again, as I said, there's a movement, and there's a beginning of understanding that the mercury represents a very substantial health challenge.